Now we're going to talk about outcome evaluation. So there are several instruments that are available to evaluate the outcome of wheeled mobility intervention. The table 2 on page 257 to 258 gives a list of some of these instruments. It also provides the information. But some of the useful ones that are used are the Assistive Technology Outcomes Profile Mobility, the Functional Mobility Assessment, Functional Everyday in a Wheelchair Instrument, and the Wheelchair Outcome Measure. The Participation Activity Measurement System requires the use of sensors and GIS system attached to the user's wheelchair. That provides a significant amount of data about the individual's activities when using a wheelchair. Also obtained through the interview. So having that technology along with the interview will allow you to gain more knowledge on what they use the wheelchair for and what they might need more help with. There has been several studies that are listed in our assistive technologies, and most of them say that there is an enhanced quality of life, which is another positive outcome of mobility device acquisition, which is knowing how to use it, what everything is, and how to function in it. Because participants would limit their community mobility because they thought they looked disabled, but individuals who reported greater satisfaction with their device and greater comfort when using it, more likely to have higher rates of participation in their home, in their community, and ones that had stronger wheelchair skills had higher levels of function. So power mobility devices enabled individuals to travel in the community to perform necessary and desired occupations, such as going for a walk or shopping, and enhanced social interactions. So all in all, being able to give somebody the skills and make them feel comfortable with the equipment will allow them to have a better life and be more functional as an individual in their home, their work, or in their community.